perform head tilt chin lift, for example. In head tilt chin lift, you have to be by the side of the mannequin. Okay? You have to be by the side of the mannequin. And the steps, you have the learning guide. All of you have the learning guide? Yes. It is in the net and in El Shuruk. You can get a copy from it. Please take care. So, the question is, perform head tilt chin lift. You will start without talking or speaking any words. You will put your hand on the forehead of the patient, and for doing head tilt, and you elevate the chin for chin lift with opening of the mouth. Okay? This is the skill or the maneuver you will do. The examiner may ask you a question. When do you do head tilt chin lift? Will answer to relieve airway obstruction in case of airway obstruction by the tongue. Of course, you have to do this maneuver while looking. How you are doing? Look, listen, and feel. Okay? This is go without saying. Okay? You have to do like this. To look, listen, and feel. Do like this. Okay? This is a maneuver. It's okay? The other maneuver that you may be asked to do is perform jaw thrust. Perform jaw thrust. You have to be at the head of the patient, like this, not at the side, at the head. You have to move. Don't change the position, but move the head. Yes. For jaw thrust, I put the fingers at the angle of the mandible and the thumb at the chin, elevating and opening the mouth like this. Okay, this is the maneuver. Okay, you put 4 fingers, but actually elevating with 2 fingers, and with the thumb you open the mouth, and you have to look, listen, and feel for what you are going to do. The question is, when do you do the jaw thrust maneuver? Yes, to relieve airway obstruction in case of suspected cervical spine injury. Okay? Third question is, insert an oropharyngeal airway. Insert an oropharyngeal airway. You have different sizes. First of all, you have to choose the correct size, the suitable size. Don't rush and take the color you are accustomed to put. Okay? You have to do to choose the exact size. Sizing is by length, from the angle of the mandible, to the incisors at the angle of the mouth. Okay? So, first of all, you will take small size, put it like this. So as the examiner will see you will see that you are understanding what you are doing. Okay? Without speaking. This is a small one for myself. Okay? This is large, long. This one is suitable. In some mannequin, this one is suitable, or this one, the difference is 1 centimeter between the two. You have to measure and choose the perfect one. Then you will put it upward till half-third, 1/3, or midway, and then rotate it 180 degrees, and then put it like this. Okay? This is how you insert the oropharyngeal airway. Also in this mannequin, you may be asked to ventilate the patient with an ambu bag or ventilate the patient with bag valve and mask. Okay? You have to take the ambu bag and with your dominant hand fix it, put it, like this, okay, with the dominant hand, the thumb at the nose, at the nasal part of it, the index finger here, and the middle and ring finger, you elevate the jaw doing jaw thrust. So you are doing C and E, okay, C and E, okay. Fix it like this without speaking and ventilate. Compression, let it fill again, relaxation, at a rate of 10 compression per minute. Yes?
What if our hand is small, so we can hold it, fix it? Do we have someone to...
No. You are doing the skill alone. And you can, if your hand is small, you can do it. Don't worry. Okay? This is the maneuver. Okay? Ventilation with the ambu bag. This is for this mannequin. For the arm, you may be asked to count the pulse rate. Count the pulse rate. Okay? Be quiet, please. Be quiet, please. The other question for this arm is, every one of you will pass on 5 skill stations. Each one maximum 3 minutes. Yes, you will take less than this time. It's measured, okay? And you will do the skill and shift to the other, to the second, to the third, till you finish the 5 skills, okay? And go out, and you will move in number. If you are in number lab 1, one of you will be in lab 1, 2, 3, 4, 5. The one at lab 5 will go to lab 1, okay? In lab 1, 2. 2 will go 3, till you are doing 5 skills. Be sure that you are doing 5 skills before going out. If the number of examiner is small, every examiner will ask you to perform 2 skills, okay? 2 skills with a checklist. And we are all the same. We are all the same, okay? Now, for performing count, the question is count the pulse rate. Count the pulse rate. I start with, good morning, I am Dr. Say your name. I will count your pulse. Okay? Then we will start by helping the person or the patient to pronate his arm. Then you put 3 fingers in the radial pulse and you start to count in 15 seconds. Then you have to multiply by 4. And then you said, thank you. Your pulse is regular. The examiner is hearing what you are. It is, for example, 60 per minute. Okay? 70 per minute. Okay? We will change the pulse count between stations. So if one of your colleagues says to you that it is 80, don't rush to say it's 80. Okay? You have to say what you are actually counting. Okay? For measuring the blood pressure, we will not use the this phone, yes, this speaker, but we'll let you hear or palpate. So I have to tell you that there may be a question while counting the pulse rate. What is the question? If the pulse is irregular. How can you count it?
3 minutes.
Yes, and divide by 3. Count it in 3 minutes and divide by 3. Okay? This is a question that may be asked in this skill. For the blood pressure, the question will be, measure the blood pressure, between brackets, palpatory only. Or measure the blood pressure. Measure the blood pressure palpatory only. It is the approximate blood pressure. You measure by putting your fingers on the radial pulse and elevating the pressure till it disappears. Okay, and you say it is 160, 150 as you find. Okay, this is if I ask you palpatory only. If I ask you measure the blood pressure, you have to do pulse, palpatory and auscultatory. First, you introduce yourself to the patient and greeting him. Good morning. I am Dr. As if it's your name, what it is, and I am going to measure your blood pressure. Okay. Then we will put to you the cuff. We will not put it. We will put it and fix it in the correct manner. First of all, you have to start. Please, if you have a stethoscope, bring it with you. If you haven't, please bring with you alcohol swab to disinfect it before you put it in your. Okay. The stethoscope, you put it like this, so as this is the direction is forward like this, so as to be in the external auditory canal, in line with the external auditory canal. First, I will put it like this before putting it in my ear. Okay, so as to save time. I'm not letting the cuff inflated around the arm of the patient and causing him harm and discomfort. Okay. First of all, I will feel the radial pulse like this. I feel it, and then I will close up and elevate the pressure till it disappears. Okay, it disappears at 150, and I have to elevate 20 to 30 above it. I will repeat again. Okay, this is. I feel it like this. You do the maneuver without speaking. Okay. The palpatory at 145. I feel it like this. I will elevate. And then I put the stethoscope in my ear and I have the antecubital fossa, not under the cuff. Okay, like this, and then I will deflate. $140. $140/80. Systolic, 140/80. So at the end, thank you, your blood pressure is 140/80. Okay? We may change it between skills. Please say what you are hearing. Okay? This is how we measure the blood pressure. If you ask it palpatory only, or if it is measure only, you have to do palpatory and auscultatory, and tell the examiner palpatory 150, auscultatory 140/80. Okay? This is how we do. Okay? We finished with this area. Please, we'll change to other.
Oh, dia lagi. Kalau palpatory macam mana tu? Dikira sini 3 minit.